that.
Thank you. Senator Heller.
Thank you, Mr. Chairman, and to Ms. Debenow for holding this particular hearing. We certainly appreciate it, and grateful for our witnesses for being here today and for your background and understanding and for the messages that you're sending to us. I believe that talking about degenerative neurological diseases, Dr. Paulson, you talked about it affects everybody. Everybody has a story. Everybody in this room has a story, and I have and I certainly do appreciate Senator Menendez's story about his mother. My mother-in-law happens to have late stages of Parkinson's. Dr. Paulson, is that considered a degenerative neurological disease?
Yes, Senator Heller, Parkinson's disease is a degenerative brain disease, and in fact, there is an overlap between Parkinson's disease and the dementias. In fact, over half of individuals who have Parkinson's disease in the late stages have dementia, so there's a Parkinson's disease dementia. And I specifically mentioned a condition called Lewy body dementia or diffuse Lewy body disease, which is related to Parkinson's disease because the same kind of protein abnormally accumulates. It's not the amyloid that Dr. Peterson spoke about, it's a different protein, but it has similarities, and in the same way that we're moving forward with new technologies and new ideas about therapies for Alzheimer's, we're doing the same for Parkinson's disease, and by extension, Parkinson's disease dementia and Lewy body disease.
The reason that I raised that issue is that she's in late stages, and she was at a doctor's appointment last week. I went in with my father-in-law, her husband, and the doctor asked, who are you with? And she said, my friend. So you can imagine the impact that that has on the family when she's at that stage that she doesn't realize and recognize her own husband of 60 plus years. So having mentioned that, I want to talk a little bit to you, Dr. Peterson. You mentioned your organization, your work with the National Alzheimer's Project Act in Minnesota. How have you been able to expand this to telemedicine? I come from a rural state of Nevada. We have the Lou Ruvo clinic that is now working with the Cleveland Clinic. I think, in fact, they had a fundraiser last week. They've raised over $250 million for this specific purpose of these brain diseases and trying to find cures and help people that are moving down that road. But the problem is it's in Las Vegas, and telemedicine has become so important for a large state like Nevada that has two-thirds of it's very rural. How do you get to these rural towns? How do you get to the Elkos, the Winnemuccas, the Elys, and try to make sure that those that are diagnosed in these stages and find it so difficult to travel, be able to get the help and services that they need?
Thank you for that question, because I think telemedicine is as a wave of the future as to how to deal with a disease as widely prevalent as Alzheimer's disease, where everybody's not going to be able to make it to a specialty clinic, not make it to the Lou Ruvo Brain Institute, but are going to have to be seen by their primary care physicians. But telemedicine offers an opportunity for those physicians then to communicate with some of the specialists, to also deal with the problems of patients in their homes. And we've been dealing with that in Minnesota. Wisconsin has a program. I was recently in Texas. Texas is developing a program for telemedicine, same principle, with large spaces to deal with. So I think that developing systems where we can communicate with the primary care physicians for specialist recommendations, but also then with the patients and families themselves in their homes, will help a great deal at reducing the anxiety, reducing the comorbidity that goes with it, and actually help the quality of life for individuals with the disease.
Dr. Peterson, thank you. Ms. Carousel, thank you for your message to all of us. Like I said, it does make a difference. We need to hear these stories. My wife's family is going through similar circumstances as I just mentioned, so it hits home. Did you have Medicare services initially when your husband was diagnosed?
We had private insurance, Blue Cross Blue Shield, and he had Medicare. He was in Social Security by the time he was diagnosed, yes.
What services were available to you?
We weren't referred, we referred to the Alzheimer's Foundation. I'm trying to think of where I found that out. Through Dr. Weissman, and that was it.
That was it, okay.
Yeah.
Thank you, Mr. Chairman.